Hello, my name is Dr. Chad Miller. I'm going to talk to you a little bit today about intestinal hyperpermeability. Most of the time people have heard of this only in its kind of common phrase name is leaky gut. Kind of a corny name, doesn't really tell you anything about what's going on, just that your gut is leaking, whatever that means. So I'm going to tell you a little bit, go into the in-depth a little bit about intestinal hyperpermeability. Okay, so most of your immune system is in the GI tract, in the gut. So if something's not running appropriately within the gut, you can have all kinds of backlash within the whole rest of the body because one system will always affect other systems. The medical model is to look at this as if it operates in a vacuum and you've got your gut guy that just focuses on the gut. You actually have to consider that the nervous system's involved with the gut, the cardiovascular system's involved with the gut, and vice versa. So everything is talking to each other, and if anything is awry, it's going to affect other systems. So some of the things you might see, of course, are the typical bloating, cramping, diarrhea, all those things going on with the gut, but you'll see weight gain, been associated with migraines, allergies, emotional issues, joint pain, the list goes on and on. Okay, so a brief overview. This is what the inside of an small intestinal tract looks like. So what we're going to see is, cross section here up to your top left is a cross section of a slice. So you're seeing several different layers from outside working inside of the intestinal tract, and inside are called villi. These little villi basically increase the surface area of the stomach contents, food, whatever you maybe have ingested, and basically break that down more efficiently, more thoroughly. So what we have here is different layers even within those villi, and if we see breakdown of that barrier, then we're going to get what you call leaky gut. So what we have right now is like a screen. It's only letting certain small appropriate particles and foodstuffs through to feed the system and work the metabolism. So if we start to see holes or breakdown in that brick wall, that barrier, then obviously we're not keeping out what we need to keep out. So the different things that can create these holes, if you will, or these breakdowns in the barrier, you can see it from dietary proteins that you have, antibiotics, stressors, inflammatory, what are called cytokines, alterations in neurotransmitters, different enzymes, multitude of different issues. And what we're going to go is we're going to focus on, okay, what is going on right here and now? How do we direct and attack the cause of the problem as well as repair the barrier system that we need to be intact. Okay, so say the screen starts to have an issue with letting things through. We have a breakdown in that barrier. Well, the immune system is going to go, okay, I've never seen that particular protein or what foodstuff that's coming through. What do I do? Well, I've never seen it before, so I'm going to attack it. And then what I'm going to do is I'm going to start signaling that there's a problem. So these immune system messengers start hollering at the rest of the guys saying, hey, let's attack this, and then let's see if we can repair and see what's going on. Well, creatures of habit, we tend to do things over and over again and end up, shooting ourselves in the foot. So after a while, we get more and more of the same food, dietary peptides, antibiotics, the list goes on and on as to how you're doing it, but typically we'll do it over and over again. So the immune system messengers put everything into high alert. We start attacking the foodstuffs, these proteins that are getting through, so we've got all kinds of inflammation going on, you're not feeling well, alarm systems are going off. But when we're attacking these proteins, many times also you're going to have collateral damage. So you end up actually creating more holes while you're trying to fight the fire. But once the fire's out, then the idea is to heal that up. But the big deal here is you got to find out what's causing the fire and get the fire out in the first place. Okay? So after a while, the screen starts to look like chicken wire. It's letting everything through. It's letting all of his buddies through, and you're having all kinds of issues, and the immune system is getting worn out. So now you've got, instead of those little blue proteins getting through, now you've got the black lightning bolts, you've got red stars, you've got red smiley faces and Pac-Man coming through. You've got all these different proteins and all these other different foodstuffs which normally you would not have any problem with, but normally they're broken down before it gets into the bloodstream, before anything can either, be fired up to create a problem. Now this protein is actually getting through, and your immune system's not recognizing that either. So you may have a normally healthy food that you're eating, but your body's recognizing it as, this is a problem, I need to attack it. So then you've got multiple fires going throughout the body, and not necessarily having a ton of problems with the gut. You can have problems with the gut, but you don't necessarily have to. So this can happen elsewhere. So like I mentioned before, you can have a migraine from foods you eat. That's pretty common knowledge. Well, you can cause all kinds of other different problems. Okay, so the food's leaking through, you're promoting inflammation, and again, reiterating, it's not just always in the gut. All kinds of different problems can occur, and most people don't recognize that what they put in their mouth may be causing a lot of their issue. Maybe not 100%, but I guarantee you it's a big player. Okay. Studying neurology, like I've been doing for years and years, we want to learn and know as much about the neurology, but we have to understand the systems that interplay. And one of the big things they teach us, when the gut's on fire, the brain's on fire. If you have all kinds of different inflammatory mechanisms that are created from what's going on in the gut, you're going to have neurological consequences, and the brain's going to be working harder, the nervous system's going to be working harder, and trying to fight this whole issue. Well, if you're fighting these other issues, you will see symptoms, and whatever those symptoms might be, it might be migraines, it might be fatigue, it might be anxiety. We can have all kinds of different issues. We can have movement disorders, we can have neuropathies. I mean, the list goes on and on. So again, gut's on fire, brain's on fire. We need to address the gut. So what do? Well, the typical approach is, let's use a proton pump inhibitor or an antacid, or let's just get you on a laxative and hopefully that constipation will go away, and then, call me in 6 weeks and we'll do some more blood tests or see what else is going on. And if we're not finding the problem, then it must be all in your head. You must have too much anxiety. Maybe we need to put you on an antidepressant. Not my approach. Not my approach at all. I think it's chasing symptoms. Maybe it's appropriate in certain cases, but it definitely overutilized. So what do we need to do? We need to do blood testing to figure out the extent and determine the exact proteins associated with what's going on with the leaking, if you will, the hyperpermeability. The tests we utilize is much more thorough, much more comprehensive than a simple gliadin alpha or a transglutaminase test. Basically, if somebody thinks you have celiac disease, they'll do a gliadin alpha celiac panel and check that transglutaminase, and more often than not it shows up negative. Well, when we're looking at that gliadin alpha is only one of like 30 some proteins that are in just the wheat protein itself, in gluten. So if gliadin beta or gliadin delta or gluteomorphin or any of these other proteins are problematic, but gliadin alpha is not, I would say don't have wheat. And that's one particular, I'm not a gluten bandwagon person by any means, but that's an example. So if gliadin alpha is okay, but all the other guys are bad, I would say don't eat that food. That's just common sense to me. Look at the whole package instead of just looking at one little needle and calling it good. So we're going to look at multiple proteins, and we're going to identify the foods that are considered triggers, if you will, and we're going to let the immune system calm down. Once that's happened, then we can work to repair the damage and quite possibly reintroduce that food, and hopefully no problems. There may be instances where it says, okay, hey, maybe we permanently need to remove that food because it's so pro-inflammatory, you have such an immune reaction to that. Let's take a break on that. Okay, my approach, look at the whole person. I'm not going to just look at your stomach. If you're coming in with irritable bowel or something like that, I'm not just going to look at your gut and what's going on with your diet. I'm going to look at the whole picture, what's going on with your nervous system, cardiovascular, lungs, liver, what's your blood tests look like, what do food sensitivities tests look like. We're going to look at the whole thing. All right, same kind of thing. The leaky gut, the intestinal hyperpermeability, would be, say, like one spoke on this particular wheel. Now, if we tuned that one spoke, you think that's going to make that wheel run true? Probably not. We need to look at all of the spokes, we need to look at all of the straws in the camel's back and address the whole person. Okay, so everything's tailor-made for the particular person. We got to get rid of the foods, repair gut damage, calm down, of course, that inflammation. Then look at the associated systems. What's going on with blood sugar and pancreas? What's going on with adrenals and thyroid? Get rid of any pathogens. What's going on with the liver and the gallbladder? And then look at the whole body. Look at the nervous system as well. So hopefully this was informative to you. I hope it gives you a little bit of an idea, kind of a basic view of what intestinal hyperpermeability is all about. If you have any questions, again, give us a holler, 402-420-2677. Thank you.